Okay, guys, this is Dr. Sean over at the Natural BodyWorks, and today we're going to go over some wrist and forearm acupuncture and dry needling. So we're going to actually specifically address arthritis in the wrist, okay? And that does relate to some of these muscles up here. We're going to go over anatomy first. We're going to go over some basic anatomy. Then we're going to go over some acupuncture points. These can be used as acupressure points. I'll show those as well. And then I'm going to actually do the treatment on me because I have actual arthritis in my wrist, and I notice it gets worse when the weather changes. Now, if you look that up, everybody says it doesn't happen, but that's not true. It actually absolutely does. I've been doing this for 25 years, and I get people all the time that tell me a storm is coming. Now today in Colorado, where I'm at, it's snowing and raining and sleeting and crap like crazy. And for the past couple of days, my wrists have been really, really tight. This is my right wrist. I do get it on both sides, but like when I pull this way, so when I invert or evert or whatever, so this is anatomical position. Remember, the anatomical position is when your hands are out like this and they're at your side, you're standing up. So when I turn in this way, this is inversion, this is eversion, I get a lot of pain right through here. When I do this way, I also get some stretchy pain through here. So I know this area is a hassle. When I do flexion and extension, I also get pain in here and here. We're going to work on the dorsal, the outside part of the arm first. It's a little bit easier to get a hold of. So we have here, we have the phalanges, of course, or fingers, then we have the metacarpals and through here, and then we have carpals. And these bones in through here, which we're not going to worry about too much because you can't see them, right? I mean, you can feel them and you can notice there's some movement when I do this. I can feel like the capitulum right in there and the lunate inside through here. And then I can also find the scaphoid as I push out. It should pop off at me. This area here is called the Anatomical Snuff Box because of those two tendons right through here. And as you push this way, it should poke out at you. And that's all tender on me. But that's not it. It goes all the way up through these. If we look at this area here, I'm going to see this kind of move as I move my fingers and wrist around. That's the extensor digitorum muscles. Okay, those muscles are actually your they're attached over here, okay, on this set of bones through here. Now this guy's the radius, and it travels around like this and ends up here. I have pain up in here and all the way through this. And then down on the bottom, your elbow, this is the ulna, and that comes down this. Now right now, if they're in anatomical position, they're side by side, but I'm turning them, and I'm rotating them, right? And so they're going to be crossing over. And that gives me some access to all of this stuff through here. And this area through here, this is the extensor carpi, which means this, radialis on here, brevis, which is the short one. So it allows me to do kind of this kind of thing. You can see it move, right? There we go. You can see as I move these fingers, and I can feel it clunking inside there. So it's very painful and it's annoying. So we're going to do some acupuncture. Now, acupuncture and acupressure, what's the difference? Acupuncture is with the needle, which we're going to use these needles here. Okay, so I have two sets of needles. I have this big giant one, which we're going to use up on the muscles. This is for the dry needling. What's the difference between dry needling and acupuncture, folks? Is dry needling is generally the westernized version. This is a little tab that holds it in. The westernized version of a needle that has nothing in it, therefore is dry. These are acupuncture needles. This one is a 0.3 by 50, so 0.3 diameter and 50 millimeters long. And this one here has a nice there we go. Put it back in its little holder. Has a nice loop on here so we can see some turning. I don't know if you can see that, but whatever. And then we have these guys, which we're going to use for the acupuncture points. These are much smaller. These are 0.18 by 30 millimeters. And they're all blister packed, as you can see. And so they're all sterile and until I just opened them, and now they're not sterile anymore, but that's okay. But we have our clean working surface here, and we're going to be doing some other cleaning stuff, and we're going to use probably 1, 2, 3, 4, 5, maybe 6 points. 1, 2, 3, 4, 5, 6. Yeah, we'll use 6 points today. And this is very similar to what I use on my patients, and I'm going to use it on me today because I want to get a few things going. I want to increase the energy traveling through the wrist. So one of the things that happens with arthritis, inflammation, and pain is we get a lot of the energy just stops and bundles up in those areas and causes inflammation and trouble. Now that's the acupuncture version, right? The the what physiological Western world would say there's inflammation in there, so we're going to have some swelling. We'd feel it in there. We're going to have pain. That's the other indicator of inflammation. And we're going to have redness, and we're going to have heat. Sometimes it does feel warm, but you really can't tell because I've been monkeying around with my arm and working on it a little bit. I'm trying to see if it feels warm. If it feels warm, that means that there's inflammation in there. If it's we're going to see that also with the needles. Okay, when I put the needles in, we're going to look for a red flash. I hope it shows up really quick because I don't want to do this for full 20-minute session. We want to kind of go through the process here. Okay, so this is exactly kind of what I do. Unfortunately, this is my right hand and this is my left hand, so we're going to have to work on that. And we are going to do a few points. So we're going to go through them right now. Now, I'm not going to do PC6, which is a really good one to do here. This is Pericardium 6. 2 thumb widths. Remember, this is 1 inch for me. So this is like if we go like this. Okay, we hold this there, and we go like that. That's about what? 1, 2. That is 2. So we could go like this, right? Knuckle to knuckle. That crease to here. That's PC6. That's a really good one. This one also works for nausea and stuff like that. So if you press this one with your thumb, and then you move your hand around, you can feel it and it will actually loosen up. This is also really good for nausea and some digestion. Oh man, that does feel good actually. Get in there and work that one. We're not going to use this one with acupuncture yet though. Okay, so we're going to work on the outside. We have this one here, large intestine 4. Okay, large intestine 4. This is on the large intestine meridian. It goes like this. Okay, and it travels up through here. We can use these points too, but we're going to use this one here. So we're going to use our little alcohol swab. Okay, and we got little circles, and we're going to do some circles here, and we're going to do like this. I'm just going to let this kind of dry for a second because these are the points I'm going to be using. Okay, and we're going to start with the acupuncture needles. Now these acupuncture needles, check these out. These are really cool. So it has a guide tube and you tap that, but this right now they're stuck because they've been made to stick. So we have to break that loose and then you can see the needle come out. Okay, so we're going to hold that like that and we're going to get this one going right here. Okay, if we go like this, there's the top of it. My finger right there and boink. Ow. No, not ow. Okay, I'm going to push it in there a little bit. Ooh, ooh. So what I'm looking for when I say ooh, ooh, I'm looking for the feeling. I can feel it in through here. Now, sometimes you get even a twitch, but we can feel it in there, and we can already see that there's redness. That's a great sign. The next one we're going to do here is, this is triple burner or Senjiao, it's called, okay? And that one kind of travels from here all the way up this way. And this is a main one for wrist stuff. So we have 1 down here, and then 2, and then 3 is right in here, and if you feel in there, it'll feel tender right in there. Yep. There it is. So we're going to get one of these again. We break the little seal, go right in here, and go bink, and it's in, and we're going to push it down into the muscle just a little bit. Ooh. Oh man, let's see it. Okay, look, watch this. See how it bends? So it's I can feel it all the way down through in here. This is a really good sign for this kind of stuff. That means we have Dai Chi. We're touching the Chi, man. That's a really good thing. Next one we're going to do here is we're going to do Senjiao 4, which is right in here. And that's really tender. So this is right on the wrist, okay? If we follow that crease all the way around, we're going to have a little tender point right in there. It follows this line. We're going to go off. So there's a little vein right there. We don't want to hit that guy. I'm going to go right in here, break the seal, go in here. This one barely goes in, okay? Goes in about 1/8 of an inch or so. This one's in a little bit more than 1/4 inch. We're going to push this one in a little bit further, okay? So this is Senjiao 3 and 4. And now we're going to go 5. So we take that one line right there where we're at, and we're going to go our 2 thumb widths. It's going to be right here. And that's already tender. I can feel how tender that one is. I'm going to find it. There, I could feel it's tender. Oh, and there's there's like a little knot there even. We're going to go right into that bugger. We got to break the seal. There we go. It's harder to do with left hand. Now that's money. Okay, we're feeling it all the way down. I feel it all the way through here already. Okay. Ooh, man, that's the big one. I even felt that in my teeth almost, man. Woo. That's a doozy. So let's go to another one. Now we can go, Senjiao 3 is 1 thumb width up. That's right here. But we're going to go even further to about 9. But I'm just going to find it by finding, right there. There's a tender point. That's about from the elbow We reach from here, okay, from the crease of the elbow, goes all the way across. We're going to go 4. So we're going to do like basically across from this to my pinky knuckle, okay, from there to there. It's going to be right here. We're going to dig in there. We're going to find that tender point. I just lost it. There it is. Oh man. Now see, as I move the tissue, we can see this moving back and forth. We are going to do that one right there. That's a good one. I don't think I'm going to have to do the dry needling. Okay, what's the difference? Dry needling, just not on. Ooh, notice that going in. Really, Okay, so there we go. So we have our 1, 2, 3, 4, 5 main points for arthritis of the wrist. Okay, so generally we'll leave these for a few minutes, and what I want to do is we'll come back and we're going to kind of turn these, and as we push